COVID-19 cases surge across Texas, but some communities are feeling the devastating impact more than others.
Those of us that do public health, we've known that there's a disparity in disease states, morbidity and mortality among people of color.
Now there's a push to bring back a state office specifically focused on minority health, how the move could help beyond the pandemic.
We're engaged in a war against this infectious disease.
Governor Abbott touts new treatments for Texans facing COVID-19, but he's taking one tool to fight the virus off the table, why he says shutdowns won't work. Will you give thanks together or from a distance? It's a tough decision this year, especially if you have older family members. The guidance to consider for loved ones in nursing homes. Hello, and thank you for joining us for State of Texas. I'm Josh Hinkle, and this week I'm joining you once again from my home studio as our crew continues to social distance amid the coronavirus pandemic. Last week, the city of Lubbock hit its hospital capacity. That meant some patients who needed treatment had to wait for an open bed. The surge is straining frontline healthcare workers.
We're really overwhelmed. We don't have beds for these patients, and those patients that need beds, it really is affecting them. So it might not affect everyone, but it does affect some people severely.
In Amarillo, hospitals brought in mobile refrigerated trailers to expand their morgue capacity. The city's getting help from the state to bring in more medical workers to handle the surge. Because of hospital staffing concerns, the city of Austin moved to its Stage 4 response level. That adds new restrictions on businesses and tightens limits on public gatherings. Austin has been taking in patients from El Paso, where hospitals are overflowing. The West Texas city now has more cases than the Dallas and Houston areas combined. El Paso's mayor urged people to avoid family gatherings for Thanksgiving in an effort to slow the virus. As COVID-19 cases continue to rise locally, the pandemic is hitting people of color the hardest, and it's the same nationally. According to the Centers for Disease Control, cases are more than twice as high for Hispanics and Black people, and deaths among Black people are twice as high nationwide. Zeroing in on Travis County, take a look at who's been hospitalized the most each week. This green line represents Hispanic patients. It's much higher than the rest. Some lawmakers say Texas had a way to start tackling this disparity issue from the beginning. They believe it could have saved more lives during the pandemic, but it was wiped out 3 years ago. Investigator Erin Cargile set out to find out why and learned there's an effort underway to revive it.
These are just a fraction of the Texans who've lost their lives to COVID-19. Among them, a high school custodian, a supervisor of a transportation company, a school crossing guard, and a grandmother from El Paso. The common thread? They're minorities.
We've lost two. They were both older folks.
Dr. Guadalupe Zamora, who sees mostly Black and Hispanic patients, has had about 220 people test positive at his practice in East Austin, which has been a hot spot for the virus.
I guarantee you that of the three I've already tested today, all three will be positive. Mm-hmm. It's coming back. We'll be at Stage 4 soon.
Hi, this is Governor Greg Abbott.
Hola, soy el Dr. Guadalupe Zamora.
Dr. Zamora has helped the governor stress the importance of masks and social distancing to Spanish speakers statewide. He's also aware there was once a state office that focused on racial disparities that could have been helping cities like Austin early on in the pandemic pinpoint areas where people lived who were more likely to get sick and create a game plan to address it.
You could make the case by going into those communities and seeing, like, what is it that's driving the spread? What is it that's driving deaths?
Lauren Laveris used to work for that office. It was created in 2010 and was originally called the Center for Elimination of Disproportionality and Disparities. Their first big project and discovery, Child Protective Services, was more likely to remove children from Black parents than from white parents. The name was later changed to the Office of Minority Health Statistics and Engagement, and the work expanded to looking into disparities across the state's health agencies. The office received about $2 million a year from the state, and Laveris was one of about 24 employees.
And I had never before then known that you could predict health outcomes by somebody's zip code. You could predict somebody's likelihood that their child's going to be removed based on their race and ethnicity. So it was really eye-opening, and I just really fell in love with the work that they were doing there.
But during the 2017 legislative session, lawmakers defunded the office due to what State Representative Garnett Coleman says was political infighting among lawmakers during the state budget process.
We'd have Republican legislators walk up to me and say, why are y'all so interested in this minority health stuff?
Coleman, a Democrat who serves a predominantly black district in Houston, believes if the office was still intact, the state would have responded to COVID-19 racial disparities faster.
We could act before people were infected with COVID-19 and tell them specifically in those areas that you have to be more vigilant. That came very late.
Laveris said she came here to the Capitol to fight for the office, but it came down to the Senate Finance Committee zeroing out the line item. I reached out to the Senate Finance Chair at the time, Jane Nelson, who wouldn't talk, but her staff was under the impression the Health and Human Services Commission would continue to collect and analyze racial data and was directed to team up with the university to continue the work. But the Legislative Budget Board told me that never happened, and the office shut down in September of 2018.
None of its functions transferred anywhere, and we just left all these people hanging.
And I think that a vast majority of Texans didn't realize this was happening.
Travis County Associate Judge Aurora Martinez-Jones had just started collaborating with the office to address an issue with Child Protective Services.
The data showed that in Travis County, Black children were 7.8 times more likely to be removed from their families than white children.
With the state office gone, she instead called on county agencies to help. 2 years later, and the data shows some change.
We've seen an improvement from 7.8 times more likely to 4.2 times more likely, but quite honestly, that's still not good enough, and we've got a lot more work to do.
And when it comes to COVID, Dr. Zamora believes the office that's no more would have been a vital weapon.
I most definitely do need it, know that we do need it.
Coleman, who lives with diabetes, plans to file a bill in the upcoming session to bring the office back.
I think it's imperative as long as we have issues that kill people.
For State of Texas, I'm Erin Cargile.
Earlier this month, State Senator Boris Miles from Houston filed a bill to partially reinstate the Minority Statistics Office within the Department of Family and Protective Services. His plan proposes using existing funding to address disparity issues in the child welfare system. After requests from lawmakers, the Texas Health and Human Services Commission launched a study to better understand how and why COVID-19 is having a greater impact on vulnerable populations. It hopes to release that information next month. The HHSC also says even without state funding for the Minority Health Office, they've tackled a project addressing obesity among minorities in Beaumont, Laredo, and Port Arthur. The commission has also worked to increase breastfeeding rates among Black women and improved pregnancy-related outcomes in Hidalgo and Smith counties. To read more about the projects the office took on while it existed, just go to this station's website and look for this story under the Texas Politics section. Governor Abbott takes one tactic off the table in the fight against COVID-19. He says the state will not have another shutdown. How he's defending his decision.
I know that the virus is there, and they need to be safe and all, but it's also important to get them with their family during the holidays.
A tough decision how to bring families together for the holidays. The guidance from the state for those with elderly relatives. And the pressure of high-stakes testing adds new uncertainty for Texas students and teachers. How lawmakers are trying to change the state's plans for the STAAR test.